About 1 in 6 men will be diagnosed with prostate cancer during his lifetime. This is an alarming fact, but with early detection and new advancements in treatment and surgical procedures, cure rates will continue to improve. We spoke with Dr. Jeffrey Yoshida of Hoag Memorial Hospital Presbyterian in Newport Beach about these latest advances.
Prostate cancer is diagnosed basically with two different tests, both of which need to be done. One is a simple blood test, testing for PSA, which stands for prostatic or prostate-specific antigen. And the second test is a finger exam, a physical examination by your doctor, where the prostate is actually felt and evaluated for lumps or bumps or hardness.
We asked Dr. Yoshida what the symptoms of prostate cancer are.
Symptoms of prostate cancer are really unusual nowadays, and I've had numerous patients ask me, well, how can I have prostate cancer when I feel so good? And the answer is that with the prostate cancer screening that's done by the primary care physicians, prostate cancer nowadays is almost exclusively caught early and before symptoms have developed, which is a good thing. Success stories in prostate cancer, especially with robotic surgery, are what really keep us as surgeons really excited about the field. A personal success story of mine was actually the first patient I treated here at Hoag that came to me from the desert. Actually, he was referred to a patient that I had operated on prior, and he's a 57-year-old male. Actually 56-year-old male, recently diagnosed prostate cancer and extremely anxious about the diagnosis. We had talked extensively about his diagnosis, and he was really nervous about his options. He elected for the robotic assisted surgical resection, and I performed that surgery about a week and a half ago. He was discharged from the hospital the day after surgery, and we removed his urinary catheter 1 week following surgery. I got an excited email from him the next day, believe it or not, and he was fully continent, was not leaking, and he's actually able to have intercourse with his wife, and that was on the second day following his catheter removal. So roughly a week after surgery, his urinary function, his sexual function was getting pretty close to normal, and I think that's a real good example of a success story in prostate cancer. I think a majority of my patients, even though they don't admit to having some type of psychological issue, whether it's mild depression or major depression, anxiety, do have some components of that, and I believe a therapist, a clinical psychologist or psychiatrist, a counselor is crucial in helping a patient deal with not only a diagnosis but also in managing the after effects of treatment of prostate cancer. We have a very well-established support group here at Hoag. We meet the first Wednesday of every month. Each month there is a designated speaker which has been arranged months in advance, and we cover all the topics of prostate cancer and prostate health. Vast majority of cancers are, organ confined very early, as opposed to 10, 15 years ago, we were seeing patients come in with widespread metastasis. You just don't see that anymore because of the screening. Yeah, it's a good thing.